All right, everyone. Good afternoon. My name is Jackie Stahl, and I'm the chair for YPN South Bend. Thank you for spending your Friday afternoon with us, and we're going to get things kicked off. Thank you for joining us for a topic I think is very needed at this time, and we're going to be discussing mental health in a pandemic and beyond. I'm very excited to introduce two psychologists from the South Bend Clinic, Dr. Gabrielle Pointon and Dr. Jamie Garvey. And they're going to be leading the discussion today. And they are located at our Portage office for family medicine, and then our Granger office as well. Part of the South Bend Clinic, we are adding kind of our total wellness for like annual exams is mental health, and we feel that's very important, and we're very excited to have these two ladies and are adding to our department to continue that and just have mental health be more of a normalcy when you're talking about health in general. One housekeeping thing is if you have questions, there is a Q&A box. And I'll be watching that, but if you can type in your question in the Q&A so we don't lose anything in the chat, that would be much appreciated. So without further ado, I'm going to kick it off to Gabrielle and Jamie, and thank you very much for your attendance today.
Thanks, Jackie. Yeah, nice to meet everybody, and thanks to YPN South Bend for hosting this, and to you all for spending your lunch break with us. Like Jackie had mentioned, my name is Dr. Jamie Garvey. I'm a clinical psychologist by training, and I work in integrated behavioral health at South Bend Clinic in Granger. Gabrielle?
And similarly, Dr. Gabrielle Pointon, so I'm also a clinical psychologist, and I work in integrated behavioral health at our Portage location.
So this is, I think, a timely conversation with the 1 year sort of anniversary of the pandemic. So we'll go ahead and get started.
Let me share my screen here, Jamie. Give me a second. All righty. There we go.
Thanks. All right. You're gonna have to run the.
Go ahead.
All right, thanks. All right, so we have a couple of objectives for today. We hope to just normalize, emotions and reactions and responses that you and other people around you have had to with the pandemic. We hope to identify the most common mental health issues that have been heightened during this time over the past year. Talk about some challenges of balancing being a professional and also your personal lives throughout the pandemic. And then hope that you can take away some strategies and concrete things that you can actually practice to help improve your mental health.
All right, so we thought this was very fitting for how mental health essentially has been over the past year for many people. So we have had to cope and make it through every day, just like we have had in the past. And it's been a little bit more like this meme. I'm sure that other people can probably relate to this. And I know we can't visibly see you, but I imagine many people could raise their hand if possible to be able to say, yeah, we're all kind of in this situation where we feel like there's a lot going on around us that we don't necessarily have control over. And that's a little bit about what we're going to discuss today. And so starting out, we thought it would be really important just to address some of the issues that you guys might be experiencing in addition to what you've been noticing maybe in the people around you since the pandemic has started. So a lot of these things are possibly not very surprising to you. You may have expected these to pop up. But some of the things that individuals are experiencing right now, and we are really seeing quite a bit of, not only in our jobs, but in our personal lives as well. And I imagine many of you might be able to say that same thing, is we're seeing a lot of anxiety and depression Obviously, it's a given that we're seeing a lot more isolation, right? So the requirement for social distancing and making sure that we're keeping ourselves safe is automatically taking away some of our natural coping skills, our social support, the people that we usually have around us to be able to be the best person that we can be. But then there are a lot of other things that you might not have come to the front of your mind immediately when you think about issues that may be popping up because of the pandemic. And one of those is primarily grief and loss. So just think about the course of the past year and what you may have had planned, the things that you were looking forward to, your expectations for what the year was going to look like. And oftentimes we think of things like grief and loss, and we think of physically losing someone passing away, but grief and loss goes far past that. And many of us have been grieving the loss of the experiences, the loss of our quote unquote normal lives, right? So that's an important part and is something that's very much on many of our minds. Then we have trauma. So many people are experiencing trauma in relation to what has happened over the course of the pandemic, losing loved ones, situations that you may be in that would not have necessarily been happening if the pandemic hadn't started. We have frustration and anger, regardless of your thoughts about, for example, some of the restrictions that have popped up with the pandemic, or some of the things that you can and cannot do. Even if you do wholeheartedly agree with those things, you can still be frustrated and angry about them regardless. And a lot of us are experiencing those emotions too. And then we have unhealthy coping strategies as well. So I mentioned a little bit earlier about how many of us, we've lost some of our coping skills, right? So being able to be in a social environment, being able to rely on our social support. And oftentimes when we lose really helpful, important coping skills, we have to replace them with something. And we're seeing much higher rates of things like alcoholism, drug use, self-injury, suicidal ideation. So that unhelpful coping strategy, it's popping up for many people right now. And I imagine there are people in this webinar right now that have experienced that very thing. So then we come to the big question, and a question that we see a lot of people asking themselves, which is our reaction normal? Should I be feeling this way or should I not be? And we want to just normalize the way that you may be feeling right now. So we know that 1 in 3 adults in the general population, and this is not just US, this is worldwide, have some sort of COVID-19 related psychological distress. So that's obviously a very general term, but it really involves many of the things that I mentioned on the previous slide. So depression, anxiety, frustration, and anger, just distress that's interfering with your day-to-day functioning, getting through the day. And we know that there are some individuals in some groups that are just at a higher risk for this type of distress. So women, younger adults, so individuals under the age of 35, individuals who are in a lower socioeconomic status. So obviously, one thing that the pandemic has brought up is a lot of financial difficulty. So if you are already in that situation and then you have this piled on top of it, obviously that's going to cause more distress, difficulty coping and functioning. Individuals living in rural areas, as they are often already more isolated to begin with. And then those that are at a high risk of COVID-19 infection. So that just brings about the fear of getting COVID, what could possibly happen if that is contracted. So there is a lot of fear here. And then depression symptoms are 3 times higher in US adults than they were prior to the pandemic. So think about that, 3 times higher. That is, it might not sound huge. We're not saying 10 or 20 times, but that is dramatic. when you look at statistics related to psychological distress or disorder. 3 times higher is a huge, huge increase from, say, last January or 2019. And in addition to that, one thing that we know is that oftentimes when people are under high rates of distress, anxiety, and depression, it gets worse, and it can bring about things like suicidal thoughts. And these have increased dramatically over the course of the past year. So if you see here, the number of people who said they seriously considered suicide within the past 30 days or the past month, it's increased the most amongst youngest adults, but even in all ages, you can see the statistics that it has gone up a great amount. So young adults from 10.7% all the way up to 25.5%. That's 1 in 4, guys. That's a lot. Then all ages, 4.3 to 11%. Practically 1 in 10, even a little bit over, are experiencing these types of thoughts. So this is why we are very dedicated to making sure to normalize the reaction that you may be having during this pandemic. That this is not just you, that it makes sense that we are having these types of reactions. And this is a global phenomenon right now that we are noticing, obviously not only in the medical field, but in the psychological field as well.
And then we move on to work. So clearly the pandemic has had a huge impact on mental health and our personal lives in so many different ways. But it also has had a huge impact professionally as well. And I think even beyond some of the obvious ones of job loss or risk of job loss, job changes, but some of the more subtle challenges as well of suddenly, a lot of folks are working from home. And with that comes obviously the change in work environment, balancing multiple roles in one space. So now you're a teacher and you're helping maybe your kids with virtual learning, and you're trying to do your full-time job, and your dog is barking and you have to cook, and it's all can be very overwhelming, and it's all just in that one space. So there's no real clear boundaries between your professional and your personal lives. So that can create a huge impact as well. And then when you think about with that change in work environment, if that's something that you connect with, again, that isolation can come in of even those small interactions that you had with your colleagues or your coworkers throughout the day, saying hi from each other, having small conversations. I know that's a loss that I have personally felt throughout this past year of, those small interactions actually do make a difference, regardless of if you're an introvert or an extrovert. So that's another piece. And then I think all of us have become sort of these Zoom experts. So that's been a new challenge of being able to switch your work lives over into virtual, and the technology challenges that come with that. And that can be quite overwhelming as well. So we have all of this that makes us start to maybe question ourselves. And while we're still balancing all of those mental health impacts that we just went over. And I think it's really important for us to consider just the gravity of all of this together. So then that brings us to imposter syndrome. So the imposter syndrome is not something that is unique to the pandemic whatsoever. Research shows that up to 82% of individuals will experience the imposter syndrome in some way throughout their lives. So this is not new, but really what it is, it's a feeling or a sense of self-doubt that you aren't capable of doing your job well, that you're not smart enough, that you're a fraud and might be found out in some way. And a lot of times the imposter syndrome can be triggered by new things. So new tasks and new roles and new challenges. And so the pandemic is a perfect time for the imposter syndrome to just really bubble up a whole lot more. And that's what we're seeing is with all of the challenges that we just went over, all of the changes that folks are going through, suddenly people are questioning themselves. Even if you've been at this in your role for years, we're starting to see some of those questions come back up of, am I good enough? Am I picking up on everything that I should be? Am I doing a good enough job? Am I keeping up? Am I adjusting? And this sense of self-doubt and insecurity around your professionalism can definitely come up. So the solution to imposter syndrome isn't necessarily for us to never have those thoughts again, because they may come up. Like I said, they're very common, and they're especially common in high achieving individuals and in professional settings. But the real solution is to talk about it, which is why we're bringing this up, because a lot of times folks are having this feeling and these questions, and this person's having it and this person's having it, and nobody's talking to each other, and it can be very isolating. Oh, I'm the only one that can't get the Zoom thing down. Well, probably not. So this is why we're really trying to normalize this part of the professional challenge as well, that you're definitely not alone in some of these thoughts or questions. And it's really important for us to start to bring that to light so that we can actually do something about it. All right. So then that goes into expectations. And these might be expectations that you've put on yourself. This might be expectations that your work or your company has put on you. Maybe it's even some, like, I think, society expectations of the new normal and adjusting. And, we've been at this for a year now. And so I really want you to kind of sit and reflect on some of these questions here, because this can absolutely lead to more imposter syndrome, more anxiety, more frustration, and have an impact on your mental health on that list that we already went over. So what are you telling yourself? Do you expect yourself to be just as productive as you were a year ago? Do you expect yourself to not feel anxious or to not feel sad some days? Do you expect yourself to not struggle during the pandemic and to just keep going? And really, really take this in, like I said, because this can have a huge impact on kind of your permission of yourself. Like, are you giving yourself permission to rest? I often say, like, shift the goalpost. Like, can you shift the goalpost for yourself to take in the underlying collective stress and anxiety that this pandemic has brought for all of us? Because again, even if you haven't had those individual losses or huge changes to your day-to-day life, there is, like I said, this collective underlying sense of grief and stress and anxiety and uncertainty that we're all kind of sitting with. So be able to kind of think about, what are your expectations and are they realistic for this time right now?
So we thought this would be really important to point out. So we need to think about, what exactly does this pandemic boil down to in terms of mental health? And we know that it has many factors besides this, right? We know the medical impact, we know the social impact, but if you look at the underlying issues that really explain all of that, they are some of the things that we as human beings hate the most, which is uncertainty, lack of control, and fear. And let's look at uncertainty and lack of control first, because I think we all understand the fear aspect, right? Live in fear, that can increase our anxiety. I mean, fear can just be something that's difficult to sit with. But if we look at that uncertainty and lack of control, that describes the pandemic in a nutshell. We never know what's going to happen day to day. We never know what it's going to look like if our family members will get it, if we get it. If we do, what will that look like? Will we get ill? Will we not? A lot of people are also now looking into the next steps. So should I get the vaccine? Should I not? Is there a possibility that something could happen? Is it going to be beneficial? Can I now see my friends? You see all of the questions that pop up, and we don't have answers for those things. Then we have the lack of control, which leads to very similar questions. We as human beings try to do our best to impart control in our lives as much as possible, because we want to be able to have the desired effect. We want to be able to see what's the cause of something, how do we lead to the solution? And in this situation, we don't have one. So we all collectively are having to sit with this uncertainty, lack of control, and fear that just as a base makes us uncomfortable on a day-to-day basis. And that's really difficult. We don't want to downplay that. And I don't know about you, Dr. Garvey, but I can pretty much guarantee that no one is sitting well with these things right now, regardless of how big it's affecting you. They are affecting all of us. So the big question is, now what? What do we do with this? We know that this is affecting many different people. We know that the levels of psychological distress are going up. We know that we feel uncomfortable largely on a day-to-day basis, and we have questions and we don't have answers. And that doesn't necessarily get us anywhere, right? That just leaves us sitting with an uncomfortable feeling. So we want to take you through some different strategies to really make sure that you are engaging in self-care, making sure that you are prioritizing your mental health at a time when it seems like it can be impossible to do that. And we want to just give you tips to point you in the right direction.
And I think that an important thing to recognize is there is no easy solution for this.
Absolutely.
We can't wave our magic wands and have everything go back to normal, although I'm sure all of us would like that to happen. We can't get that past year back. And like Dr. Pointon mentioned, we're sitting with all of this on a day-to-day basis, and our brains do not like that. So it's very, very understandable and valid and normal for our brains to fight that, to fight reality, and to sort of try to search for some sense of control. And while that's understandable and it's valid, it's not always helpful. And so that's where acceptance comes in. Of instead of fighting reality, fighting the past year, fighting this is the way it is, which can cause more suffering and can lead us to be carrying around this weight. Acceptance, it doesn't mean that you like it. It doesn't mean that you want it or you approve of anything that's happened. Acceptance, I think, is just a way to let go of the heaviness of fighting reality and be able to move forward in a more effective way. And there's a couple of different strategies that will help you to sort of operationalize acceptance, because it's sort of this vague concept of, oh, okay, I'll just accept it. Okay. But it's not quite that easy, because like we said, there's not just one easy solution. So the first strategy is called mindfulness. And so I'm sure you've all heard of mindfulness. It's a big buzzword right now. But all it really is it's coming back to the present moment intentionally, non-judgmentally. And the non-judgmentally is the big key there, because with all of those questions that Dr. Pointon mentioned, all of the questions of what's going to happen next, and am I going to do this, and is this person going to be okay, that really pulls you into the future. And that's what anxiety does. Anxiety is very future oriented. with sadness, with depression, it tends to pull you more into the past, thinking about, ooh, like this happened, and this is what I lost this year. And again, understandable where your brain goes there, but really what's missing is the present moment. And so mindfulness can help you to ground yourself, come back to the present moment in a more accepting and open way. I like to think of it as if you go outside on a nice summer day and you bring a picnic and you lay a blanket down on the ground, anything can fall on it, right? Leaves may fall on it, rain may fall on it, bird droppings, food, anything can fall on it. And so that's kind of what mindfulness is although it involves some relaxation, it doesn't necessarily mean that you have to be relaxed or you have to be happy during mindfulness. It's just connecting to the present moment. And so the key here is it's a practice. And so every time that you notice your mind starting to go to those places, go to those questions, sort of catch it, recognize it, and just gently, non-judgmentally bring yourself back to the present moment. And a nice way to do this is your breath. So your breath is a really great anchor. It can be calming, it can be soothing, and you're always breathing, hopefully. So it's nice because it's this constant, and it can really help you to connect to the present moment when you are getting way too far down into the future or the past. So that's one. I'm going to skip over the second one real quick and go to observe your feelings in your body. So that kind of connects with mindfulness a little bit. And so what that is if you are feeling overwhelmed, if you're feeling like you're stuck in your head, just come back to your body. You know, where in your body are you feeling these certain emotions? Maybe it's a tightness in your chest. Maybe it's your stomach. Maybe it's your head hurts. Just kind of bring your attention into your body and really try to picture what it looks like. Like, what is that feeling? Does it look like a rock? Does it feel like butterflies? Is it a certain color? Is it hard or soft? Is it hot or cold? And by sort of picturing it and kind of putting an image to it, it actually helps us to obviously come back to the present moment, but it also helps us to accept that feeling in your body. And so one thing that we kind of like to say is, how can you make room or space in your body for that uncomfortable feeling? Because again, pushing away pushing away reality and uncomfortable feelings, while it's understandable, it can actually create more issues. So we really want to practice that acceptance, opening up and finding ways to allow some space in our bodies for the uncomfortable. And that's going to also help you to tolerate distress a lot more as well. So then I'll go back up to acceptance of your thoughts using cognitive diffusion. So this is another strategy that is all about acceptance, obviously, but it helps us to accept some uncomfortable thoughts. So if you tend to catch yourself being in your head a lot, cognitive diffusion can be really helpful, because what it is it's not pushing away your thoughts. It's not saying, no, I can't think this way. I can't have these thoughts, because they're going to come up. That very common, don't think of a pink elephant. And then what do you think of automatically? Shows us, of course, just kind of shows us that, pushing away your thoughts isn't all that effective, and it tends to take more energy. So being able to change your relationship to your thoughts, those thoughts, while they may be dark and scary or uncomfortable or anxiety provoking, we can change our reaction to our thoughts, which will allow us to not be all consumed by them, but also to accept them a little bit better. And one easy way to do that is to sort of defuse from your thoughts. So rather than like latching on and attaching yourself to your thought and acting as if it's true. It's an objective fact of like, this bad thing is going to happen, period. That sounds like a fact. It's sort of taking a step back, defusing and recognizing our thoughts, our sensations, our emotions are all subjective, and they're not cold, hard facts or truths about the world or about the future. And so an easy strategy to do that is, rather than this bad thing is going to happen, period, we just add on to it, I'm having the thought that. So I'm having the thought that this bad thing is going to happen. It's a very subtle shift, but what it does is it's that slight reminder that, oh, okay, this is just a thought. And because it's just a thought, it doesn't mean that it's true, doesn't mean that it's ever going to be true, and it doesn't mean that I have to react to it as if it is true. So that's a nice one for diffusion. And then the last one that we have listed on here is values. And so even in the midst of all of this uncertainty and lack of control, being able to connect to your values and what is most important to you can help give you a greater sense of meaning and fulfillment. And what do I mean by values? Values are different than goals. So whereas values are sort of like a direction to head in, you can't necessarily check it off. So if I have a value of health, it's not like, oh, well, I'm healthy right now, so I never have to worry about it or think about it again. You can absolutely set goals in line with your values, and we encourage you to do so. But it's not necessarily something that ever is checked off and achieved, but it continues to guide you in a certain direction as what is most important to you. So that may be connection, it may be health, like I said, it may be knowledge or curiosity or anything. But it can be very helpful to connect to your values and recognize what are those values that you can maybe start to work towards or live your life in accordance with throughout the pandemic. Recognizing that that may look very different than it usually does, and finding those small ways within some of the limitations that our world currently has to still connect to your values and find that sense of fulfillment.
So our next step is engaging in self-compassion. So this is incredibly important given what we've already talked about, the uncertainty, the lack of control, the imposter syndrome, all of the experiences and emotions and thoughts that you may have popping up for you. It's very important to be able to act compassionate towards yourself so that that level of distress comes down, the way that you critically think about yourself comes down. It really lessens the intensity of the emotion. And we have a couple really simple ways to engage in these types of strategies. And once again, just like what Dr. Garvey talked to you about, these are subtle shifts and they are very clear strategies that can actually make a pretty significant difference in your day-to-day life. And the first one is really embracing what we call a common or a shared humanity. And so this is actually a really important aspect of self-compassion. And it's essentially the recognition that we all share similar experiences. We have a common or shared humanity. And those experiences also include negative experiences or suffering. So if you think of compassion, just the word in and of itself, it literally means to suffer with. And so we are recognizing that what we are going through right now is a similar experience to what the people around us are going through. And it's really saying that the pain that you experience now, the difficulty that you experience now, is the same pain that you've experienced before in different situations. It's the same pain that other people are currently experiencing. Now, the triggers are different, the circumstances are different, the degree of the pain is different. So maybe you've had a little bit of stress in the past and that's greatly increased, but the basic experience, the feeling, the emotion is the same. And what's really important here is just having that recognition to allow yourself to be a little bit more understanding towards yourself, be a little bit less judgmental, and allow yourself to have trouble, have inadequacies, not live at the same expectation that you lived at a year or two ago. And sometimes just being able to shift our outlook, shift the way that we're thinking, and embrace that common humanity can make a significant difference in our lives. It can also help us better connect to the people around us, even if we can't necessarily do that in person right now. Now, the second one is practicing gratitude. So this is one thing that I have talked with a lot of my patients about, just making sure that you're bringing gratitude in your life. And sometimes people can have an initial reaction of like, yeah, that's easy to say, just write down some things that I'm grateful for. That's not really going to make a big difference. And I totally get that. I understand that initial reaction. It seems like just a monotonous thing that isn't really going to have a big impact, when in reality, research shows that practicing gratitude consistently on a day-to-day basis has a very significant impact on not only our daily outlook, our symptoms of depression, anxiety, but also just on our day-to-day functioning and how well we are handling stress and distress. And often the way that I suggest people to begin practicing gratitude is what we call gratitude journal. And it is a very simple, easy strategy of writing down 5 to 10 things that you are grateful for every day. And people prefer it in different ways. Some people like to wake up and do it immediately first thing in the morning. Some people, it's kind of hard to think about that stuff right when you're waking up and you're still a little groggy, haven't gone through the day yet. So many people like to do it at the end of the day after they've had experiences that maybe have been stressful, so it can help reframe the way that you're thinking and the way that you're feeling. And it is a very simple strategy, which I often think in these times is better than a complicated one, because we already have a lot of stuff that we're handling and that we are really just having weigh on us on a day-to-day basis. So this is a quick strategy that can have a big difference. Another thing that is really important is we always give great advice to other people, right? We're super good at that most of the time. We might not always have a good answer, but we can at least be empathetic, compassionate towards others. We can say, I totally understand where you're coming from. This is just a really hard time. You have to give yourself some grace. But we can't do that to ourselves often. Some people are super great at it, but many people really struggle. And when you are noticing those negative thoughts, those critical thoughts about yourself popping up into your head that are making you feel like you're not living up to expectations, like you are that imposter, I would really encourage you to ask yourself one question, which is just, how would you comfort a friend or a loved one in this situation? So if I were to come to you and detail to you everything that I'm struggling with, and it's the exact same things that you're dealing with, what would you say to me? And it's really reframing that the ways that you are treating others, that compassion applies to you too. And the last thing is what we call a loving kindness meditation. And this is something that can be really helpful. I encourage you all to just kind of write this down and look it up, because there are many, this is usually comes in video form. There are many different meditations that allow us to intentionally think about providing love and compassion towards ourselves, because sometimes we don't necessarily know what to say to ourselves. We're not used to that pattern of providing ourselves with love and compassion. And this is a good starting point. It's a good first step to hear what self-compassion actually looks like and how we can start speaking to ourselves and shifting that self-talk. So these are a couple really easy, quick strategies, and we know that self-compassion has a pretty big impact. And so acceptance mixed with self-compassion, mixed with self-care, which is what Dr. Garvey is about to talk about, can significantly impact your mental health during this pandemic in a positive way.
So self-care, I think that this is something that, the second that we tend to get more stressed and more overwhelmed, we tend to stop doing. And that's usually the time when you need it the most. And so self-care, we don't mean it in terms of just like bubble baths and lighting candles, although that's great. Self-care is a whole lot more encompassing and at times less fun than that. And so while it can include those things, and obviously trying to make sure that you're coping in healthy ways and that you have healthy outlets for your emotions and for your stress, even just the simple act of us having this conversation and hopefully normalizing your experience and your emotions can be a form of self-care. Recognizing and maybe even using some of that self-compassion to sort of talk to yourself and be like, yeah, it's been a rough year. This has been a lot for me, can be a form of self-care. So that's kind of where we want to start. One thing that's not necessarily on here, but I think goes along with it, and also going back to those expectations that we had talked about in your professional lives, is really looking at your expectations can be a form of self-care. And I use the word permission because sometimes it's giving yourself that permission to rest, giving yourself that permission to turn off the computer early, and even redefining what does productivity mean to you right now? What does productivity look like during a pandemic? I think can also be a form of self-care. Then more on the behavioral side of things, we've got behavioral activation. And behavioral activation is scheduling in activities throughout the day that get you up, that get you going, that could be maybe pleasant and enjoyable, but could also be social. They could be tasks. Just really making sure that you have some sort of structure, because again, our brain craves consistency and it craves knowing what to expect. So if you're feeling like you're kind of all over the place, maybe just jot down a couple of goals, a couple of things that you want to do or get done during the day. And that's going to help to just give you a sense of more structure and control for that day. And again, behavioral activation can be really helpful for creating that structure. It's also a treatment for depression, and can be a really helpful component because our behaviors influence our emotions. And so you may recognize, when I don't do XYZ during the day, I just feel really sad or down or less energetic, less motivated. And then maybe try scheduling in some things and see how that impacts your mood. What do you feel? Staying connected and relying on social support, it can be a huge challenge. I mean, that's what we're talking about. But finding those little creative ways to check in with people, to stay connected to your social support system, even if it's not in person. I know we're all zoomed out, and Zoom fatigue is a real thing. But finding other ways to still make sure that every day you are talking to somebody that you care about, or you're reaching out, or that you're getting those social needs met, because as humans, we are social beings, and that can greatly, greatly impact our mental health. And then taking care of your basic needs. And again, I think that this is something that's easy to say, but with everything that we've talked about so far today going on, it can actually be really hard to do. And so I think as a strong foundation of self-care, as including sleep, regular nutrition, and regular movement. And movement can be anything. It doesn't necessarily mean exercise, but really making sure that you're trying to go to bed and wake up at relatively the same time every day, that you're trying to get enough sleep, and that you're allowing that time before bed to really wind down and let yourself fall asleep, turning off technology 30 minutes beforehand, having good sleep hygiene, making sure you're consistently eating balanced meals throughout the day, and then getting some movement in. And again, it does not have to be exercise. It can be any form of movement. Maybe you get up and dance to a song in the kitchen, or maybe you get off of a meeting and go play with your dog outside. Any sort of movement that, again, gets you up and gets you going can be really helpful for that strong foundation of self-care. And then one that's not on here, but that I do want to highlight, is that just recognizing when you need more, recognizing when you need professional help, and when the anxiety and the depression or anything, any symptoms, any struggle is getting to a point where you can't maybe manage it on your own, or recognizing that you don't have to manage it on your own. I think that can be a really, really important part of self-care too, is asking for help and reaching out when you need it.
Okay, so takeaway here. So we hope that this has been helpful. We provided a couple new strategies for you all. And obviously the first takeaway is just that your emotions, your reactions to the pandemic, they're all valid. They're all warranted based on this situation. They make sense. You're not expected to be who you were 1 year ago. And I would frankly be pretty impressed if you are. So keeping that in mind, normalizing that reaction, lowering your expectations, and taking care of yourself to make sure that we don't reach a point where we are burnt out. And as we become more afraid, isolated, feel a little bit more inadequate, have that imposter syndrome pop up, we start to shut down. We start to stop things that we used to really like. We start to isolate ourselves even more. We lose that motivation, and we need that self-care, acceptance, self-compassion. We need to focus intentionally on those things to break that cycle and start to accept our lack of control in order to allow our emotions to be there, for us to experience them, for them to pop up, but for them to not be so all-consuming, so overwhelming that we can't function. So we hope this has been helpful. And now we were just going to move to if we have any questions or comments.
And so I'm not seeing necessarily anything in the Q&A part. So if you do have any questions, please feel free to type them out. Or I don't know if you can unmute yourself, but we're totally open to that too.
Yes, feel free to ask questions or put it in the chat box or the Q&A, however you guys feel more comfortable.
Well, thank you, Megan. We just got a comment saying thank you for sharing this with us today. Thank you so much for having us. And I cannot see participants, so if you do,
I'm watching.
Okay, thank you. Thank you. And if there's no questions, that's all.
Oh, here's one.
Here we go.
You see it?
Yes. In terms of how to prevent burnout in the workplace, what recommendations do you have for people, leaders, managers to best care for their teams during this difficult time?
That's a great question, Jamie.
That is a great question. I think that many of the things that we've talked about today can definitely be translated to a workplace or team type environment. So making sure to check in on the individuals around you. And if you are a manager or a leader, that would obviously be employees, making sure to continually check in. Possibly, if possible, we know it's not in all situations, provide a little bit more of that flexibility and even stress how important self-care is. I know that I've seen individuals in the past just be able to encourage something like exercise with employees to have a little incentive for that, or just continually check in by sending self-care resources to employees' emails, things like helpful sleep habits or important things that are coming up in the community, which I know has been halted a little bit today. Jamie, do you have anything to add for that one?
Yeah, I think, for especially the leaders and managers in the workplace, it's also being a good model for those things. Because I think it's one thing to send out, yeah, self-care, do it, have boundaries. But then if you're not really practicing that yourselves, or maybe you're sending mixed messages because, you're sending these things out, but then you won't let a person leave or something like that. I think that can be really confusing. And so making sure that you yourself are engaging in good self-care. And like Dr. Pointon mentioned, just really having these conversations, with your colleagues and with your employees so that it's something that's normalized and people can actually feel comfortable sharing their concerns openly in the workplace. Because I think it's one thing to say, yes, we recognize this, and it's another thing to really put it into action.
And then,
go ahead.
Go ahead.
So we had a really good question. So thank you, Madeline. This says, there's a lot of advice out there for people who have been working from home. What resources and advice is out there for frontline workers who have been going into work daily since the very beginning of the pandemic, especially for those who work with vulnerable populations? So thank you, Madeline, if you're a frontline worker. Thank you to all of our frontline workers who have truly just been in the weeds since this has gone on, and now we're a year in. I think that our resources would still be the same in a lot of ways, in terms of making sure that you're having these collective conversations at work and being able to support one another. Obviously if you don't have large chunks of time for self-care, I'd like to say take moments of self-care. And that can look different in a lot of different ways, of even if it's just taking a minute to breathe, or going outside if you've been inside all day. I think finding those moments of self-care and practicing that mindfulness can be really helpful. Dr. Pointon, do you have other suggestions?
Yeah, so I definitely agree with that. I also think oftentimes, I don't know what exactly you've been experiencing, Madeline, but oftentimes these are situations when we experience a little bit more of that frustration or fear, or we feel that a little bit more intensely. So I would just worry more so about burnout for a frontline worker than for someone who works at home. So really, really monitoring that, seeing how you feel, and reaching out for help if necessary, because this is where it's going to be really important to possibly process through some of those intense emotions that you may be feeling, or just the sheer exhaustion that you might be feeling, since this has been going on for a year now and you've been out there the whole time. I think it's really reaching out for support if needed, and giving yourself a little bit of grace to help process through that emotion.
Absolutely. Yeah. I think that's even more important. If we always say, like, you have to fill your own cup before you
Yeah.
fill others. And that is
Absolutely.
absolutely true for our frontline workers.
Yeah.
All right.
Okay. We really appreciate everyone coming today. Oh, Megan, thank you so much. I appreciate that.
Yeah, thank you.
And if obviously you all have our names, if you have any additional questions, if you have any other follow-ups that you want to have with us, please feel free to reach out. We're incredibly open.
Yeah, thank you all for attending. And I truly hope that you could get something from this. And yeah, feel free to reach out.
All right. Thank you guys again. This has just been I think, such a necessary topic to talk about, and just thank you for shedding that light on this and really bringing it to the forefront, and it's very needed. So thank you. We really appreciate your time. Again, thank you to all the attendees as well. This was recorded, so please feel free to share with colleagues and friends, and really get the word out on that there is a light at the end of the tunnel on how to help one another. I have some great takeaways from this, and the imposter syndrome, wow, that really hit home. So thank you so much for sharing. And YPs, we do have some upcoming events, so please feel free to make sure you're following us on Facebook, Instagram, LinkedIn, for all those upcoming events, and sign up for our newsletter to make sure that you are getting kind of our up-to-date what's going on. But otherwise, thank you again for spending your Friday afternoon with us, and have a great weekend and enjoy this weather. Thank you all so much for attending.
Thank you. Bye.
Bye.
Thank you so much. All right. Bye-bye.